Have you heard about the dangerous fungus spreading across the country? The CDC says it's an urgent threat.
It's called Candida auris, and it's resistant to several antifungal medications. Cases have been reported in Illinois and Indiana.
And joining us now is Dr. Robert Citronberg. He is Executive Medical Director of Infectious Disease and Prevention with Advocate Healthcare. Good morning to you. Thanks for joining us.
Good morning.
So tell us exactly what is this fungus and who is at risk right now?
It's a fungus. You're familiar with Candida infections. Those are things that cause very common skin infections. This is a particular type of Candida that can cause a serious infection. Now, first, the good news is that the general public, people who are not hospitalized, not sick, are at essentially zero risk for contracting this. This is a concern for people who are in the hospital, particularly those who are very chronically ill, maybe those who live in long-term care facilities, have IV lines or feeding tubes. Those are the type of people that are at risk for getting this infection. And when they get it, it actually can be quite severe.
So if it's resistant to antifungal medications, what are the other options to treat it?
Well, it's resistant to many of the common ones. We still have antifungals that are available to treat it, but some of those don't work as well as the ones that we'd like to use. So it can certainly be more challenging to treat, especially when it gets into the bloodstream of patients.
Doc, let's talk about the symptoms, because I read somewhere that I could even have it right now and not show any symptoms and still be spreading it. Can you clarify that?
Sure. So, that's really the concept of colonization, right? You could potentially carry this fungus on your skin, but if you're otherwise healthy, you're not chronically ill, it can't do any harm. It can't make you sick. So you could potentially be walking around with it. Maybe healthcare workers could walk around with it. Patients who are in the hospital can walk around with it. It really only becomes a problem if it gets into your bloodstream, like if you have an IV catheter or something like that. So you can certainly, and lots of people walk around with it on their skin, and it's of no concern at all. It's only really of concern in those people who are sick, and the symptoms typically would be things like fever. If you're very sick, your blood pressure could be low. But again, only really in people who are sick, and principally in the hospital or in other long-term care facilities.
All right, doctor, thanks so much for joining us. Give us an update on this. We appreciate your time. You take care.